Hello friends. Today I will tell you about natural treatments and home remedies for interstitial lung disease. Interstitial lung disease is more than one disease. This is a term which is describing more than 200 different lung disorders that all affect the tissues and spaces around the alveoli in the lungs, called the interstitium. The most common symptoms of interstitial lung disease include chest pains, unintended weight loss, dry, chronic coughs, trouble breathing and shortness of breath, or key joints or muscles. Depending on the underlying causes for this condition, you can develop a fever or signs of an allergic reaction, swelling in your lower legs, headaches, difficulty sleeping, fluid buildup in the lungs, caused by fluids and water collecting the air sacs of the lungs. Fingertips and toes get wider and rounder at the ends. The most common causes for interstitial lung disease are genetic abnormalities, exposure to toxins or agents that damage the lungs, and conditions that affect other parts of the body, like autoimmune diseases that affect the blood vessels or collagen that forms connective tissue. People who are between 40 and 70 have increased chances of getting interstitial lung disease. You need to know that there is no cure for interstitial lung disease, but the home remedies aim to reduce the severity of symptoms. You need to talk with your doctor if you suffer from interstitial lung disease before you use some of the below-mentioned home remedies. So in this way, you will avoid any side effects. Here are some home remedies for interstitial lung disease. Number 1. Eat well. Those people who have interstitial lung disease may lose weight because it is uncomfortable for them to eat and because they have to take extra energy to breathe. These people need to eat a nutritionally rich diet, which contains adequate calories. You need to talk with your dietitian, so he or she can give you further guidelines for healthy eating. Number 2. Stop smoking. If you suffer from interstitial lung disease, then the best thing which you should do is to stop smoking. You need to talk with your doctor about options for quitting, such as smoking cessation programs, which are using different proven techniques to help people quit. Also, second-hand smoke can be harmful to your lungs, so you should not allow people to smoke around you. Number 3. Avoid refined and processed foods. If you suffer from interstitial lung disease, then you need to avoid refined and processed foods, such as fast food, fried foods, and foods that are made with refined grains, hydrogenated fats, and added sugar. Number 4. Pulmonary rehabilitation and exercise. Pulmonary rehabilitation is including many different therapy approaches which can help to improve the daily functioning and the well-being of people who suffer from interstitial lung disease. Pulmonary rehabilitation can include emotional support, nutritional support, occupational therapy to make every activity easier, an exercise program that is safe and appropriate, usually including both aerobic and strength training, exercises that can improve lung function, and physical therapy. It is very important to stay active, such as by working with a physical therapist or personal trainer who has knowledge of interstitial lung disease. This is very important for supporting the lungs, cardiovascular system, and immune system. When you are not active, then this can make pain, swelling, stiffness, and shortness of breath worse. You need to talk with your doctor about safe ways for staying active, such as doing yoga or tai chi, cycling, swimming, and walking outdoors. You should aim for 20 to 30 minutes of moderate exercise. You can make a slow jog or a brisk walk on a daily basis if it is possible. Number 5. Stay hydrated. If you do not know, your lungs are 83% water. You need to drink a lot of fluids to prevent coughs and dehydration, which are associated with fever, as well as with gastrointestinal issues. You need to drink water at most, but you can also drink herbal teas, vegetable juices, and herbal infusions. Number 6. Oxygen therapy. Oxygen is primarily used to reduce the complications which are associated with low blood oxygen levels, such as trouble exercising and shortness of breath. This type of therapy can help to make breathing and physical activity easier, improve your sleep, and it can help to reduce the blood pressure in the right side of your heart. Some people are using oxygen while they sleep or exercise, while other people use it all day to control the symptoms of interstitial lung disease. You need to talk with your doctor about using a pulse oximeter at home. This is a small device that is placed over your fingertip and it tells how much oxygen is in your blood and if you require more. Number 7. Reduce consumption of high-sodium foods. These foods can make the symptoms of interstitial lung disease worse, so you need to avoid them. Some examples include bacon, salami, ham, olive, soy sauce, and table salt. Also, many processed and packaged foods are high in sodium. You need to replace high-sodium foods with eating fresh products, lean protein, and healthy fats instead. Number 8. Antioxidant foods. You need to eat different fruits and vegetables, which can help to maximize the antioxidants, vitamin, mineral, and fiber intake. Some of the best choices include sea vegetables, green tea, cocoa, all types of berries, melon, cherries, mangoes, citrus fruits, herbs and spices, garlic, squash, tomatoes, carrots, broccoli and other cruciferous vegetables, sweet potatoes, and all types of leafy greens. Please note, these remedies may not be suitable for everyone, so you should select one that suits you, and if required, kindly consult your doctor. Thanks for watching. If you liked the video, hit that like button, and don't forget to subscribe. See you soon.